Hello everyone. Today we are going to discuss a second station related to Simman. So this is upper GI bleed station. Yesterday we discussed postpartum hemorrhage, and just a quick recap. Like whenever we see a patient, so the patient would be in either of four situations. Either the patient would be alert, giving us all the history, or the patient would be responding to verbal or painful stimuli, or the patient would be unconscious at all. So this is what we call AVPU. So if the patient is unconscious and you look at the monitor and the vitals are fine, still you have to do this ABCD approach because the patient isn't talking. And if the vitals are deranged, so you have to start with ABCD approach. But if the vitals are fine and the patient is responding to you, so we have to start with history, and then we have to do the examination, then we have to make a diagnosis, and then we have to do a treatment. So this is how we do these stations. So in upper GI bleed station, the patient would be presenting with dizziness, and this will be acute history of dizziness. So you enter the cubicle and you introduce yourself to a nurse and to the patient, and so the patient will be saying, "Doctor, I've been feeling dizzy." So what will you do next? So what you will do next is you have to decide what approach you need to apply. Whether you have to start with ABCDE or you have to start taking history. And for that you have to look at the monitor. So look at the monitor after that, and the vitals would be fine. Everything would be fine. So start taking history. Just verbalize whatever you see on the monitor. So in the history, if the patient is coming to you with dizziness, so what are the differentials? So we are going to start like, what do you mean by dizziness? Do you feel that room is spinning around, or you are feeling that you're just going to faint? And then ask about TIA, any weakness in your body, ask about arrhythmias, ask about tiredness to rule out anemia, ask about bleeding anywhere, and what else you can ask? Ear problems. So these are the differentials you need to ask. You can ask more, and then you come to the medical conditions. Do you have any medical condition? And the patient would be saying, yes doctor, I've been having osteoarthritis. So are you taking any medication? Yes doctor, I've been taking NSAIDs for a very long period of time. Are you allergic to anything? No. At this point, the patient would say that, Doctor, I'm really embarrassed. I just soiled myself. So say to the patient, do not worry, we are going to take care of you. And then the nurse might say, if there is a nurse around, that, Doctor, I'm going to look into it, and there would be a dark stool. So once you get this thing, so you know that what is your diagnosis. The patient is having osteoarthritis, the patient is having in dark stool, the patient has been taking NSAIDs for a very long period of time. So this is upper GI bleed. So at this point the patient would give you a signal that, doctor, I'm feeling more dizzy, or doctor, I'm feeling short of breath. So what you have to do is, if the patient is giving you this signal, you have to look at the monitor again. So now the patient vitals would be drained. The patient oxygen saturation, for example, it is again 88%, and the BP it's 90 by 70, and the pulse is 120. So we have to start with ABCD approach. So you have to say that uh, as my patient is talking, so I assume my patient airway is patent. So I would like to give my patient 100% oxygen at 15 liter per minute through mask with the reservoir bag. So now next is breathing. So just do the inspection and auscultation, and then in the C part we discussed before that we have to say that, nurse, could you please attach two large bore IV cannulas, green color in both arms, and give Hardman solution at 500 ml within 20 minutes, and also take blood sample for blood grouping and cross matching, and arrange at least 4 units of blood. So and some basic blood investigation. So at this point the examiner would improve the vitals. So oxygen saturation improved, vitals improved. So now you have taken a history. So the next step is doing the examination. So if someone is coming to you with upper GI bleed, so what you have to do the examination, you just need to verbalize, I would like to do tummy examination. You do not have to do it, actually examiner wouldn't let you do it. So and there wouldn't be any finding. So after the examination, now comes the diagnosis. So you have to explain that. So from what you have told me and what I have assessed, I'm thinking you are having this condition called upper GI bleed because you are having this, you have been taking NSAIDs for a very long period of time. So this is the reason. So what would be the management? So for what we have to do is we have to stop this painkiller immediately. We can refer you to some rheumatologist. They might give you some other painkillers which wouldn't be affecting your stomach, and we have to admit you into the hospital, and we have to inform gastroenterologist. We have to give you some fluids, and the gastroenterologist, they might do endoscopy to look for the cause of the bleeding. So this is the specific management. If someone is coming to you with upper GI bleed, so you can mention about PPI, you can mention about referring to gastroenterologist, endoscopy. So these are the specific management. But what you have to do, make sure is that you are a safe doctor. You have to apply this ABCD approach. So what happened is in this station we didn't start with ABCD approach like we started in the PPH station. In this station we started with the history, and then we moved to the, in the mid we started doing this ABCD approach. So this is what they are going to do. In some station we do not have to do ABCD at all. In some station we have to do ABCD in start, and in some station we have to do it in the mid of the station. So the next station again related to this C part is uh, post hysterectomy dysfunctional uterine bleeding. So the patient might have this hysterectomy due to dysfunctional uterine bleeding, and after this operation now the patient might be bleeding internally. So the specific management for this problem is re-exploration, and we know that what we have to see, say in the C part, to make the patient stable. And we, if the patient vitals are deranged in the start, so start doing this ABCD. And if the patient vitals are fine, so start with history. At what time did you have this operation, why you had this operation, what are you feeling now? So these are the questions you can ask and do the examination. In the examination you can look at the look at the wound to see if the dressing is dry or soaked, and you can look at the uh, look at catheter if the patient is having if there is any bleeding inside the catheter, to look for the cause of the bleeding. So this is how we are going to do this station. So you can read this station and you know that how to approach this station. So three stations. Problem in C part, approach is similar. We have to see like when to apply this ABCD approach or not, and what we need to say. So this is it. I hope it helps. Thank you.